the simple things in life. Either it does or doesn't feel right. It's the simple things in life. Come on, baby, let's ride.
Hey guys, it's Smiles Behind Lupus. Today will be a educational video. Sorry I look the way I do. I don't feel good. I was going to do this in our office, but that was not the case. So I apologize. I don't have my selfie stick or anything in reach. I think it's still in the car. So if I'm looking that way, it's because I'm trying to learn to look at the camera lens, so on my phone. Anywho's, so with everything that I've been dealing with the last month or so with my health and the rheumatologist discharging me from a patient I just wanted to come on to try to help some of you guys that are newly diagnosed or could be in limbo of looking for a new provider. Some of the tips that I can give when you're in a flare, you know, how to better manage it to get the treatment and the help that you need. Unfortunately, it's like when you get labeled with a chronic illness, no matter if it's autoimmune or not, I feel doctors get so afraid to treat you. So they always, in our case, or I can speak for myself, in my case, they would just say, oh, it's your lupus that's flaring up. You need to contact your rheumatologist. But then it's like when you get to the rheumatologist, they're like, well, the primary could have treated XYZ. And then it's like you're going back and forth and you're stuck in the middle and you don't know what to do. And I feel like that's why a lot of us wait to we're almost like can't talk, walk almost to go to the ER or anything like that, because it's almost like other doctors, I'm not necessarily saying they don't believe you, they just don't want to take the time because we're too complicated. I've heard that a lot. Well, lupus is a very complicated thing, as if we ask to have a complicated disorder. And I feel like being in the medical field for 15 years in patient care, seeing the ins and outs of patients and complaints and different things that you see in healthcare, I guess one thing I can say is always research the doctor or specialist that you're trying to be a part of to make sure they can really truly understand your case. Whether it's family practice, rheumatologist, whatever specialist, do your homework. There are lots of websites now like HealthGrade that scores the doctors and rates them in patient experiences. They're, you know, commented below to say, hey, this person has no bedside manners or whatever. And some people have to realize, I've worked from primary care to neurosurgery, specialists, all of that. So what I have found, primary care doctors are very compassionate. Not all, but most are. But when you get into the specialty realm, 90% of them are not compassionate doctors. They're not going to hold your hand. They're not going to, you know, pat you to make sure you're okay when you're hurting. It's like they see tunnel vision, black and white, that's it. And that's, you know, they're good at what they do. But as far as the patient bedside manner, it may not be there. So you have to weigh your options. Do you need both of that? Or do you want someone that's going to treat you, that knows what they're doing? The doctor that did my back surgery, I worked for him. But he's literally the best that we have from here to hundreds of miles away. Like, people came from Paris to see him to have back surgeries. And he is not warm and fuzzy by any means. He will not hold your hand. He will come in and say, this is what's wrong, this is what you got to do. And either you're going to do it or you're not going to do it. But he is awesome at the surgeries and the recovery time and the scars. And So you have to weigh your option. Do you need it or you don't need it? And some people require both. And some people have thick enough skin to understand, as long as you're doing right by me, then that is all I need. So always, research who you're going to. Ask around the family and friends. Like, there's plenty of stuff on the internet now that you can, to make that decision. When it came to the rheumatologist decision that the lung doctor sent me to, he flat out was like, well, you gotta have this one doctor that's about, in the 40s or whatever, very aggressive treatment, but she doesn't have really good bedside manners. And I feel like when it comes to rheumatology, I need someone that's going to have the knowledge of my disease as well as compassion, because you're going to spend more than 90% of the time with that rheumatologist when you have lupus than you are with your primary care or any other doctor. So that was important to me. So I'm like, okay, no, send me to the older one, but that has good bedside manner, because I don't have time to argue with anybody that, that's very closed-minded. So that was my decision when it comes to the new rheumatologist. Being discharged from practice, never in my life have I ever been discharged. And I mean, when patients in our practice got discharged, it was new to normally, like, they're going to other doctors getting narcotics, or, they were just like blatant, never showed up for appointments, and only wanted to come in when they were on deaf doors. Like, I never missed appointments with her. If I did, it was due to like being in the hospital or something. I've asked, I can probably count on one hand how many times in the 3 years or since I've been diagnosed, I got diagnosed in 2014, that I've ever, 4 years, that I've ever like asked for a work-in appointment. I really think it was a breakdown in communication with her staff, which I've always had an issue with the one nurse, because she never relays the message the way that I say it. And we've butted heads on that, and I've talked to the doctor about it, but hey, I mean, it's a good thing, I guess, if you have a doctor that backs you as an employee, but if you're wrong, you're wrong. But to get a letter to say that I was non-compliant because I called in and say that, hey, something's not right with my stomach, I can't keep anything down, I can't take this medication right now, can you please work me in? And my face is numb, and my pain doctor is really concerned what's going on, but then I get discharged for being non-compliant, and then I'm in the hospital when you call me. So I look at it, a couple family members all said it's a blessing in disguise, because there's a lot of questions, because she was never consistent as a doctor. And I think me being in the medical field and her knowing me from that aspect side of things, it's a good and a bad thing. When you're known in the medical community or who you've worked for, it's gotten me into a lot of doors when I didn't have health insurance. So I'm very thankful in that aspect, but at the same time, sometimes it's like a hindrance. Because I need a doctor that's going to be more motivating and willing to try other options for certain things, and not just try to force pills down your throat all the time. And that's why I left the pain management doctor, who they're very close. He just kept pumping me full of pain meds that if I said, oh, hey, this isn't working because we know your body is immune, he would just give me something new. He wasn't trying to say, hey, I think we need to wean you off, let's try this alternate. Like, none of that ever happened. And he was so negative. But he knew me. We would joke. We would laugh. But when it came to my health, like when I was on oxygen, he's like, you're never going to get off oxygen. And I said, well, I don't know what God you serve, but I'm not going to be on this oxygen forever. And that's exactly what I told him. Same thing was like when my diverticulitis flares would happen. He would say, well, they're going to have to probably take out part of your intestines because, if you have more than 2 flares a year. And I'm like, no, sir, not going to happen here. I don't need that. I'm not saying I need a doctor to be in the same religious preference as me, but I need to have a facility that respects my views, that I serve a God, and you don't come in a room and just be negative. I'm not saying don't be blunt and don't sugarcoat the truth, But when you say that to a person, it's like, oh, you're never going to get off oxygen. Like, how dare you? And then it's like, when they see you again, it's like, what? You're not on oxygen anymore? I can't believe that. I can, because I serve a good God. So you have to weigh your options. And with lupus, we have flares that some days it's just where you can't get out of bed. You're in so much pain. You got some days where you have other symptoms. Your breathing is bad. Your stomach is flared up. Like, it's so many symptoms that we have to deal with, and we have to weigh our option. Do we call our doctor? Don't call our doctor. And my rule of thumb is, if you're new to having lupus or your disease and you don't know, by all means call your doctor. But I feel like I would be in a flare and I wouldn't call my doctor. And maybe that's a bad thing, that I wouldn't call them until maybe like day 2 or 3, when I'm like, okay, this isn't getting better. Maybe I need to be on a Medrol dose pack or whatever. But normally with lupus, it's like in waves. Normally it gets really bad. But yeah, if I can't breathe, or like the issue that I had with the numbness, which I waited too long, you need to seek medical attention as soon as possible. But you, at that point, you start getting discouraged when every time you go to the ER or you go to your other doctors and they do nothing for you because they want you to go to the rheumatologist. And it's like a fighting act of Congress to get in with your rheumatologist or any specialist because they're so far booked out. So that's why we have to learn, like, what symptoms are something that's normal that we can kind of deal with and something that's not. I remember in patient care, and sometimes you have to give nurses slack when you work in a doctor's office, because healthcare has gotten so to the point it's all about money and to see as many patients as possible. I remember in family practice, I worked for an entire year by myself with the doctor. They wanted us to see 25 plus people in an 8-hour period, which of that 8, you got to have your lunch break. I was responsible for all phone calls called back, checking patients in during their vitals, getting any referrals that they needed to outside doctors, getting any tests scheduled. I was responsible for that. And you're having patients almost every 15 minutes. So it's like one person, it makes it very difficult. And if you have an office that's small, please, I'm not saying that doctors should not call their patients back or whatever. Just know sometimes you get overwhelmed. And when I worked for the neurosurgeon, we would see in one clinic 40 people twice a week. So we had 80 patients, and out of those 80 people, probably 70 of them were going to have surgery. So therefore, I was, stuck the days the doctor was in surgery trying to get authorizations, trying to get surgical plans. So just take account, if a nurse doesn't call you back after a message or 2 messages, call the office manager. That's the way to solve the problem, and make sure, hey, I know they may be busy, but I'm really having a hard time. I think that is your best solution versus calling multiple times or doing whatever to try to get that nurse on the phone. So that's just something to keep in mind. Talk with your doctor to say, hey, what protocols do I need to see you for? What symptoms do I need to see you for? And what would be something my GP can handle? Or when should I go to the ER? Like, ask those questions so you better know how to handle when you're in a flare or having something going on. And if it's something new, that's completely different. But get guidelines so and you can kind of relay that to your general practitioner. Say, hey, I spoke with my rheumatologist and she'll treat me for XYZ. But like if I have like a general cold, she prefers that you treat me, but I will relay the message, or you can have your office call and say, I'm putting the patient on this antibiotic or whatever. So everybody is in the loop. because you will be surprised how many doctors say they're going to send a note to your next doctor and it never gets there. So it's like a big gap in communication because they have no clue to what's going on. So take it as from yourself to make sure you're relaying whatever messages from whatever doctor. And then if they happen to get the note, that's a bonus. But if not, at least they're in the loop. Or you can request, hey, I really need you to call my rheumatologist. This is their number, and let them some kind of way communicate so you know you're on the same page. Because as we know with autoimmune, certain medications interact with other things and other treatments. So everyone needs to be in the loop. Because if you're having surgery, some stuff you have to come off of before surgery. So it's a lot of stuff that you really need to pay attention to, when you're dealing with autoimmune disease. So that would be series 1. I don't even like to call it series because then I forget to come back and do it. But that's going to be part 1 when it comes to finding a new provider and how to handle flares and symptoms. I will come back with some more educational points when it comes to the healthcare and dealing with the rat race that we have to deal with having chronic illness and going through the healthcare system and getting denied from insurances and getting denied for disability and getting, all of that, dealing with how you have to handle work and, protecting your job and, you need health insurance and different stuff like that. With that being said, I will see you in the next video. So be blessed. Comment below other topics that you want me to cover. And I will try my hardest to get them out.